Welcome to all of our listeners today, including our colleagues in state asthma programs who are funded through CDC's National Asthma Control Program. We believe that collaborations in care are vital to positive health outcomes. Patient care is truly at the heart of all we do here at Allergy and Asthma Network. Daily, we work to end the needless death and suffering due to asthma, allergies, and related conditions through a four-pronged approach, including outreach, education, advocacy, and research. My name is Tanya Winders, and I am the President and CEO of Allergy and Asthma Network. I also currently serve as the President of the Global Allergy and Airways Patient Platform. Before coming to the network, I spent 17 years in leadership roles within the allergy and asthma industry, from sales and marketing to managed market access. I'm also a proud graduate of Louisiana State University, where I earned a master's in business administration. I've been leading the network for 8 years, and I certainly love connecting with people on a national and international level to spread awareness and preparedness messages to patients, families, and caregivers. And I love working with leading experts to build patient-centered collaborative care teams in order to achieve optimal health outcomes. But this work is also very personal to me. I'm the mother of 5 teenagers and young adults, 4 of whom are living with allergies and asthma. We have a wonderful team at Allergy and Asthma Network, and I'd like to introduce 2 of them to you today. First, Marcella Yemignani is our Director of Outreach and Development and also our CDC Grant Manager. Marcella is a journalist and communications specialist, and she has over 30 years experience working with Hispanic audiences. She is bilingual and works to ensure that our publications and resources are accessible to our Spanish-speaking patient community. Next is Tanya Nash. Tanya is our Assistant Project Manager for the CDC Exhale grant that we'll be discussing today. She's a public health consultant and certified health education specialist with over 15 years of experience in both the public and private sector. She recently served as project manager for our Not One More Life Trusted Messengers program in Atlanta, Georgia, where she is based. Tanya is passionate about communicating health information in a way that people from all backgrounds can easily understand. Today's webinar is filled with information. Our program outline is that we'll provide a brief current state of COVID because in 2020, 2021, all of our work certainly has had to be framed in the context of the pandemic. Then we'll spend some time looking at health disparities, steroid stewardship, and the resources that we have at Allergy and Asthma Network for patients and caregivers and for you as state asthma program managers. And then finally, we'll leave time for your questions as we discussed. So let's get started. So today we'd like to know who is actually with us, who's on the line. So we're going to make this interactive and I'm going to launch our first poll. If you could go ahead and indicate which best describes you. Are you a physician, physician assistant, nurse practitioner, school nurse or nurse, respiratory therapist, asthma educator or health educator, or patient? And we understand some of you may fulfill multiple roles, but please go ahead and enter the one that best describes you. We have several hundred people on the line from all across the nation today, so very grateful for each of you spending your time and a bit of your afternoon with us. All right, I'm going to go ahead and close the poll and share. Looks like that we've got about 3% physicians, 3% physician assistants and nurse practitioners, close to 50% nurses and school nurses, 38% RTs, asthma educators, health educators, and 10% patients. So definitely a very diverse, multidisciplinary group on the line today, and we look forward again to the interaction. So again, when we are talking about this time frame and the work that we're doing at the network, so much of our efforts have had to turn towards COVID-19. And even in the context of the way that we're supporting families living with allergies and asthma, so much of the conversation is focused on the pandemic and its impact. And the Johns Hopkins dashboard is the perfect place to go for reliable information on the current global case rate, as well as here in the US, which we can see is now quickly approaching the 30 million case mark. And then it also tracks the deaths related to COVID. And again, you can see that here in the US, we're now at close to 526,000 deaths. And then, of course, we always rely heavily on CDC as the most trusted source for data when it comes to all things COVID, but also asthma epidemiology and other chronic diseases. And you can see here that the CDC's data is indicating we've had over 28, almost 29 million cases with 41,675 new cases with the latest report. And that 7-day case rate per 100,000 is 121.6, with the total deaths again, just over 523,000 and 877 new deaths in the latest report. Again, this is a very valuable resource because it shows the case rate with the darker blue colors by state. And so you can always reference the CDC report to see how your state is tracking and certainly to get the latest numbers when it comes to COVID impact. Now, in the news, there is new headlines around the $1.9 trillion COVID stimulus package that's just passed through the Senate. And certainly that's welcome news to so many Americans who continue to suffer the economic fallout of the pandemic. And that will help to re-stimulate the economy. And then in collaboration, we've also heard about Moderna and IBM, who said on Thursday that they're actually going to focus on technologies that will employ artificial intelligence, blockchain, and hybrid cloud to improve the information sharing that's happening among governments and healthcare providers. And they believe that this will help to address the potential supply chain disruptions that are being impacted by the pandemic. On Monday, President Biden did extend and enlarge a travel ban that President Trump had enacted previously, and also stated that people who are not U.S. citizens can no longer travel from South Africa, Brazil, the UK, and 26 additional European countries. So these travel restrictions certainly are continuing to have a dramatic impact on the way in which Americans are living and traveling and engaging in business and life. We also know that there are variants of the virus. The different versions of the virus that cause COVID-19 are spreading very quickly, and the pace of new infections has generally been falling across the country. So while that's great news, these unique variants and versions of COVID-19 are continuing to keep us on our toes and learning more about this virus every day. So on Monday, the CDC did release new guidance indicating that those who are fully vaccinated can move forward and spend time with unvaccinated people indoors without wearing a mask, as long as those who are unvaccinated are at low risk for severe COVID-19 complications. And this presents what's considered a low risk of virus transmission. And as the size of gatherings increase, and certainly as we involve other households, the risk increase. So taking that into consideration about how you choose to gather, where you choose to gather, when you choose to gather is very important. And then finally, the CDC said that in gatherings with fully vaccinated people and unvaccinated people from different households, everyone should continue to wear a mask and practice social distancing as much as possible. So the new case rates by day, this trend line, again, is something that we have followed for right at a year now at Allergy and Asthma Network. And you can see that especially since mid-January, thankfully, those new case rates by day have continued to fall, including into this first week of March. At Allergy and Asthma Network, we've developed a COVID-19 information center that has a wealth of resources. We update this information center on a weekly basis with news, webinars, fact sheets, podcasts, and infographics. And all of these resources have been truly tailored to different segments of the population. And so please go to that COVID Information Center and you'll see many different resources on what you need to know, whether it's FAQs, asthma and COVID, vaccine adoption, school resources, mental health resources, things like latex allergy and COVID, and additional webinars and videos. We also have launched a new program called Black People Like Me, and this is a convening that has been funded and supported by PCORI of several hundred African American patients that are living with asthma or compromised lung health and who are at risk for COVID-19. And when these have been listening sessions and learning sessions where, again, the community has been very vocal about what types of research they would like to be involved, why they're involved in research, but also what their concerns are as we're living through the pandemic and as those that have those underlying compromised immune systems or compromised lung health. Much of our work at Allergy and Asthma Network is on the unmet need and the burden that is experienced by those high-risk communities within the broader asthma community. And so in the next section, we're going to talk a bit about health disparities and the need for greater health equity. Now, we all know that COVID-19, the pandemic, has unfortunately shown a very bright spotlight on the racial disparities and inequities in our country. And so you can see here in this chart the share of population when we're talking about white versus Black versus Hispanic or Asian or Native American versus the share of deaths in relation to the virus, and then also the share of cases. And so specifically why we've designed these programs and projects for communities of color are as a result of this data, where we see the Black population represents 12.3% of the general population, but over 20% of the share of deaths and close to 20% in the share of cases. And then when we look at the Hispanic population, 17.8% of the general population, but over 20% in the share of deaths, and again, almost 30% in the share of total cases. So again, it's these types of numbers that cause us great concern and consternation, which is why we have moved forward to develop specific programs around addressing how do we achieve health equity and the need for greater health equity. This is an infographic that we have shared readily because the truth is this isn't just about health. There are many systemic injustices that have existed for decades, and that is driving the disparities when we talk about asthma, also the disparities when we talk about COVID-19. So things like housing, minority stressors, food security, stable income and job security, environmental quality, neighborhood conditions, access to quality, affordable health care, and education opportunities. So when we talk about how do we address the unmet need, we have to take into account many social and economic factors rather than thinking solely about access to quality, affordable health care. And this presents us with many practical challenges. We know that when it comes to asthma disparities, it also can lead to vaccine disparities or vaccine hesitancy. And so some of these things that we often think about in asthma disparities, like access to care, transportation, income, poverty, making very hard choices on taking medication or skipping medication, environmental allergens and irritants, education inequality, and then the very basic of language and cultural differences all come into play when we're talking about how to best address asthma disparities and meet the needs of the population that we serve. That led us to our very novel approach to addressing asthma disparities called Not One More Life. The Not One More Life program is presented in partnership with communities of faith, health ministries, local schools, and other community partners. And this provides individual case management and telephonic as well as telehealth visits within the community. We've gone into different faith-based communities and schools and offered free asthma clinics, pulmonary clinics for asthma and COPD, and also offered medication assistance and support to specialist care like allergists and pulmonologists. And so this is an ongoing project that we have at the network. It was established originally in 2003 and has now expanded to over 19 cities. In 2020, however, we utilized the Not One More Life program to really turn the focus to COVID-19. How do we get COVID screening, COVID education, and also COVID vaccination? And that is where we continue to focus today. So the novel approach that Not One More Life offers is a short didactic presentation on asthma and underlying lung health conditions with Q&A following that. And then we have pulmonologists, allergists, and primary care volunteers who actually do screenings, use validated questionnaires and spirometry, and then review those results with the participant. And then we stratify that population into low, moderate, and high risk, and actually do follow-up at the 1, 3, and 6 and 12-month interventions to support those individuals with digital health and telehealth that are in the high-risk group. So certainly, again, just to reinforce, the COVID pandemic is harming people of color more than any other groups. And we know that this isn't right. And that is why we have developed this Trusted Messenger program and offered a free 16-week digital health program to support those that have underlying uncontrolled asthma and yet are trying to navigate life throughout the pandemic. I'm going to share a short video about the Trusted Messengers project, and then we'll move on to our next topic in the agenda today.
Trusted Messengers is an Allergy and Asthma Network project bringing testing, education, and care to often overlooked communities.
The people that got together to come here to be able to make sure that we're healthy, to make sure we're making the right advances, not just for our health, but also for our wellness, and to put all this together, I think was a very, very big deal.
From the time I pulled up the gate, I was welcomed. They walked me through the process. They made me feel very comfortable.
The people who are driving through to be tested, some are essential workers, some are families, and our community lacks those resources.
An event like this makes me feel good because it lets me know that someone actually cares about my community.
For the African-American community, we are predominantly affected health-wise. We're in those fields where we are exposed.
Put all this together to have free testing.
They were educating me what I need to know about my body, which made me feel comfortable that I'm on the right track.
To be able to help us stay healthy and do the things that we need to do to be able to thrive as a community.
So I love the fact they're just not helping me, but they're helping others as well, and they're helping generations to come.
To have no insurance needed.
My parents are uninsured, like so many other Americans. So for the fact that I was able to come, and it's a free service.
We all have an opportunity to come together to do something that's going to affect us all as a community. I think is super important. It's essential.
This is the epitome of serving your community, you know? So thank you, guys.
Yes, the doctor even thanked me for coming, but I want to thank them for the service. We thank you for your time, really, from my heart.
The end of each event is only the beginning. Trusted Messengers connects communities to long-term follow-up and education to support lung health.
Sorry about that. So again, I hope that you can see how proud we are of this program and of the way that we are moving it forward to really now focus on vaccine hesitancy. We know that even if offered a free coronavirus vaccine, that fewer than half of Black people and only 66% of Latinos said they would certainly take it. And so this is based on a survey that underscores the challenges that arise and that exist in communities that are hit hardest by the pandemic. So now I'm going to ask our next poll question, which is, how have you been aware of how disparities affect your personal life and people that you work with. So we'll go ahead and launch that second poll. Have you been aware of how disparities affect your own personal life or people that you work with? Yes, no, or I'm not sure. Give everyone just a moment to log in their response, and then we'll share collectively. We've heard from many of you in the state asthma programs about the challenges and the concerns within your communities of actually helping patients to navigate. Is asthma a risk factor? Is it protective if you have controlled asthma with your inhaled steroid? There have been so many different news stories and conflicting beliefs around, is underlying asthma a risk factor for complication from COVID? And it looks as if on the data, it really has to do with control. If you have well-controlled underlying respiratory disease, then you may not be as at risk for complication. On the other hand, if you have uncontrolled respiratory disease, then again, your likelihood of having complications from COVID are even more so. So let's close the poll and share. 79, almost 80% of you say yes, you are personally aware or know someone that has been affected by disparities, and then 14% not sure, 8% say no. All right. So now let's talk a bit about some of our efforts in asthma and severe asthmas and uncontrolled asthma, specifically around steroid stewardship. We know that oral corticosteroids certainly are medications that often are prescribed to treat severe or uncontrolled asthma. Oral steroids, though, should never be confused with anabolic steroids or with inhaled steroids, because we know, of course, that inhaled steroids are the mainstay controller medication for most asthma patients. And anabolic steroids, consequently, of course, oftentimes are used in bodybuilding and other sports related and are not the same as oral steroids. However, oral steroids do have a number of side effects. They are inexpensive medications that certainly work to quickly reduce inflammation in the airways, but they aren't without some side effects and certainly harm if overused. So how do we know if we're using oral steroids too often? The network has been leading an effort around steroid stewardship, and we have a consensus statement by all of the professional societies and patient organizations throughout the US to say 2 or more courses of oral steroids in a 12-month period is too much. So if you have a patient or working with a family that has that idea or concept that, oh, I'll just manage my exacerbations or my flares with oral steroids, we need to change that belief. So it's important to speak with your doctor about various different treatment options and to realize that more than two or more courses of oral steroids is an indication of poor asthma control. And in fact, there's new data that shows if you've only taken 4 or more courses of OCS in your lifetime, that it can have very negative long-term side effects. So this is why we developed our OCS Overexposed, which is a digital and social media campaign to drive awareness of this topic. We have many different partners, including the Asthma Allergy Foundation of America and the American Association of Respiratory Care and others that are doing independent and collective activations to drive awareness and to change policy when it comes to the use of oral steroids in respiratory. We also have continued to develop very valuable resources for patients and caregivers, and so we're going to review some of those now. We have a number of different infographics, things like this infographic with asthma facts that you can easily access on our website for free. You can download many of these and use them within your own presentations. We're always happy for you to do so, as long as you just credit the network for the original content. We've also developed what we call patient learning pathways. These are very short educational videos that are easy to understand, evidence-based, and on demand on a variety of topics, as you can see here on the right-hand side. Each of these is less than 5 minutes. and gives you the basics on managing the disease, on diagnosing, managing, and treating the diseases that are represented. Under our CDC National Asthma Control Program grant, much of our focus is on the Exhale technical package. And you all know, of course, that indoor air quality and indoor air pollution are vital aspects of long-term comprehensive asthma management. So we have a new webpage on allergyasthmanetwork.org that addresses many of these questions. Why is indoor air quality important? How does it actually affect or impact our health? What are some of the most common indoor air pollutants? And how can indoor air quality actually be improved? How can it be tested? And even more. And so we encourage you to visit all of our website, our new website that was launched in May of 2020, but specifically this page to learn more around indoor air quality and air pollution. I mentioned earlier about the CDC Exhale strategies and the technical package, which is guiding so much of the work that we are supporting with you as state asthma programs and partners. We do have a campaign to promote Exhale strategies that will be ongoing through our social and traditional media, as well as our digital media. We'll be developing additional resources for patient education in both English and Spanish. And we'll have an actual dedicated Exhale website with resources and best practices, where truly we want to create a forum to hear from you on what's working well. We know that under Exhale, there's the focus on asthma self-management skills and education, as well as extinguishing smoking and tobacco use, home trigger reduction, achievement of guidelines-based management, linkages to care coordination, and environmental policy change, especially when we talk about occupational risk and hazards. So it's by working with you in the state asthma programs and our other partners at CDC and other nonprofit organizations that we can work together to better understand how to actually impact our community and address these key 6 elements of the Exhale strategies. Also, in 2021, we'll continue to host our U.S. Asthma Summit this year. Go ahead and mark your calendars. It is pinned for November 5th of 2021. This is our annual convening of now over 1,000 community stakeholders, where we highlight best practices in asthma management. And certainly we also bring you up to speed on the latest scientific evidence in managing asthma as well. So mark your calendars. We'll look forward to seeing you all at the U.S. Asthma Summit on November 5th. We have updated our asthma poster series, our respiratory treatments poster, as well as our respiratory tools posters. All of these are available for you and are disseminated for shipping and handling costs only. We also have digital downloads that you can always access at our store or website as well. And then our host of COVID-19 resources, fact sheets, infographics, definitely, again, these are all free of charge for you to download and help to support your community in the most effective, tailored manner. These are some of the resources that we developed with our Black community specifically on COVID-19, understanding the difference between COVID, the flu, and allergies, which is always an important topic as we near allergy season. And then also on how to protect your family. What are the prevention strategies? And then we have 2 new resources, one on vaccine adoption and one on making the most of your routine care visits that are also tailored to the African American community. These are some of the few resources and infographics, again, that are both in English and Spanish, reinforcing the 3 W's from the Surgeon General on washing your hands frequently, watching your distance, and of course, wearing a mask. So let's launch our final poll question. Are you planning to utilize Allergy and Asthma Network's resources in the coming months? We'll launch the poll, yes, no, or not sure. We hope that most of you will respond yes. We try to listen very closely to you and hear what resources are needed. Definitely, if you have ideas or concepts that you would like for us to further support you with, please reach out at any time, let us know, and we will be happy to co-create and develop those resources and help to disseminate them as well. Okay. We'll give it just another moment while we finish logging in the results here, and then we're going to turn to your questions and answers. So it seems like we've got about 85%, 85% that say yes, they'll be using the resources in the coming months, and then about 14% that aren't sure, and a couple of percent that say no. So thank you for sharing that. Right. And again, please don't hesitate to reach out to Marcella Yemignani, Tanya Nash, or myself as we continue to lead in engaging the state asthma programs. I also want to say a huge thank you, of course, to Paige Welsh and to the CDC National Asthma Control Program staff. They have continued to support us and been such wonderful partners for so long as we have worked together to end the needless death and suffering due to asthma. And so now we're going to turn to your questions. And again, I'll encourage you to go to the control panel and enter those questions at this time. Let's see. Thank you for the nice comment, Laurel, about the slides. That is courtesy of Sally Schessler, our Director of Education. We will make the slides available for anyone who would like to have them after the fact. So the first question comes from Dinah, who says, can a nasal rinse and saline gargle twice a day reduce the viral load exposure? If yes, will this be included in the WHO's advice for the public? So I have not seen specific data related to COVID-19 with a nasal rinse and saline gargle, but I do have anecdotal evidence from patients that are doing so, and a few of our healthcare professionals that are recommending that. But I have not seen anything formally from the WHO, but great question, Dinah. Next up, let's see. So this question comes from Jessica. With the new guidelines in COPD, is COPD considered an underlying condition for getting the vaccine, or why is COPD considered an underlying condition for getting the vaccine but not asthma? So, you know, this has been a very hot topic in our community. Unfortunately, most states did not include asthma as in that phase 1A group. While COPD was included, and even in many states, smoking, a history of smoking, qualified you for phase 1A vaccine. So Allergy and Asthma Network stepped forward, communicated with our friends at HHS, as well as with the White House and the current administration, and put together a letter which actually advocated states and encourage states to move forward with including asthma as one of those underlying conditions. And we've seen several states move to include asthma in that phase 1A. Now, as states are moving more to the phase 1C, phase 1B, phase 1C stage, thankfully, those living with any underlying condition like asthma can receive the vaccine. But this was a great concern to us as well. And I think it has to do, Jessica, with that conflicting information that came out very early in the pandemic, that perhaps asthma might be protective. But what we've come to learn, again, is that it is those that have controlled asthma that are using their inhaled corticosteroids as prescribed that oftentimes get that additional benefit. Next question comes around, do we have resources on sleep health or meditation? We do, actually. We've got a number of resources on sleep and the impact that allergies and asthma have on sleep. And then we also have a number of resources and even some guided meditation exercises from one of our experts on our website. So please feel free to visit Allergy and Asthma Network, or just Google Allergy Asthma Network sleep or meditation, and those should come up. Right. Will the respiratory treatments poster be updated in 2021? And is it available in Spanish? So we are working on a current update of that treatment poster. And we also will be updating the Spanish version this year as well, Ashley. So please look forward to that. And we are actually just waiting on one image, and I think we'll be able to launch that digitally, and then they'll also be available for printing and download. Okay. Going on to some of the other questions. So Tony asked if we could go over some of the specific ways to reduce indoor air pollution. So again, we know that there are a number of air purifiers that definitely will help to remove certain particle sizes. We also know that there are strategies around reducing indoor air pollution by keeping your windows closed, and of course during the peak allergy times. But we have a whole host and a resource dedicated specifically to this. And so Tony, I'll ask that we get that sent out to you after the conclusion of today's webinar. So Carolyn asked if the U.S. Asthma Summit will also be virtual this year. We do plan to host this summit both live and virtual in a dual capacity. And we're hoping that the American College of Allergy, Asthma and Immunology meeting will be live in November as it is planned, but then that will have a virtual attendance option as well. I also should have mentioned that we have our annual Allergy Asthma Day on Capitol Hill coming up on May 4th and 5th. This is an opportunity for you to virtually come to Washington, D.C. and participate with us in a congressional briefing at noon on May 4th, as well as individual visits with your federal decision makers in virtual visits on May 5th. And so if you go to Allergy Asthma Network and again, look at Allergy Asthma Day Capitol Hill 2021, you'll be able to go ahead and register there for free. We also have an advocacy training that will be available on that day, as well as a fun benefit concert and some awards ceremonies. We talked about the comment from Erica around the high-risk priority list for COVID vaccine and our position of certainly asthma should be in that earliest group. A question around the recent EPR4 update, NHLBI's EPR4 update. We did a webinar comparing and contrasting EPR4 to GINA just a couple of weeks ago, and that is available on our website. You can visit allergyandasthmanetwork.org and look for EPR4 versus GINA for that update. We are tending to support GINA as the most up-to-date evidence-based approach, because even EPR4 did not account for data after 2018 and also was only a partial update, not a complete update. So Karen, we would encourage you to really lean heavily on GINA as the most recent updated global guidelines for managing asthma. So if you are interested in our Trusted Messengers program, there's a question here from Helen. We have volunteer opportunities. We are going to be expanding the live events to 10 different high-risk communities in 2021, and we would love for you all to get involved. So please drop us a note at our email, either Marcella or Tanya or myself. We'll be able to help support you and get you enlisted to perhaps volunteer and come out and support our efforts in spreading these education and awareness messages. So a question here around the increase in wildfires over the last couple of years. We have developed several different resources around climate change and its impact on asthma. And yes, the increase in wildfires is a phenomenon related to climate change. So we put together a resource called How Climate Change Affects Asthma and What You Can Do About It. And we continue to think that it is so very important to incorporate weather as well as air quality in all education messages when it comes to asthma. Right. Right. So the next question comes from Claudia, and she asked specifically about current research that's ongoing for asthma, EOE, allergies. So there is a wealth of different research projects that are underway, and you can always go to our website. We have a tool where you can put in keywords and find any clinical trial that is available, a tool called Antidote. And then we also are consistently making our members aware of research opportunities. So if you would like to be involved in research, please reach out to us. We would love to have you involved. We've got an asthma registry, our Asthma 360 program, where we consistently reach out and let people know about opportunities to participate in research. So certainly we would love for you to be involved. There is a lot of ongoing research around what we call Eos-driven, eosinophilic-driven diseases. And we actually have just developed an Eos Asthma Toolkit that was launched at the Quad AI meeting. And again, we will send that out as a link to all of you as we begin the active promotion of that tool over the next month. But we're going to be hosting a webinar in April solely about the topic of EOS-driven diseases and this connection of things like asthma, EOE, allergies, and others. Right. Just a comment from Kathy around the importance of EPR4 versus GINA in the CDC cooperative agreement. I understand, Kathy, and certainly appreciate that point. And we do use both of those documents, but again, our concern is that it was only a partial update. It was not a comprehensive guidelines update. Okay, let's see. Any concerns about vaccine and allergy is a question from Jennifer. And so again, Jennifer, in the COVID-19 webinars that we've been doing, our expert, Dr. Purvi Parikh, has uniformly said that the risk of allergic reaction from vaccine is much less than the risk of getting hit by lightning. And so certainly the greater risk is in not getting the vaccine, getting COVID-19 and having complications, even complications that can lead to death, as we know, for over 500,000 Americans. So definitely there is that risk. If you are allergic to the component in the vaccine, the propylene glycol, then that is the only time that the vaccine is contraindicated. But if you have a history of reaction to vaccine or anaphylaxis, then it is recommended that you get your vaccine in a site that is able to monitor you for half an hour and respond to an anaphylactic emergency should the need arise. Okay. Final question is in regard to Not One More Life. If you want to get involved in our Not One More Life program, please reach out to either myself, Tanya Winders, twinders@allergyasthmanetwork.org, or to Marcella Yemignani, who is our CDC project manager. She will be happy to connect you into the program as well. All right, well, I think that just about covers it for the questions that have been posed this afternoon. I think we got to the majority of them. Again, I want to thank you all for listening today as we've looked at the value of evidence-based resources and guidance. We certainly hope that the information that was presented was valuable and that you can move forward with us in your asthma care and work and journey. We would certainly love for you to join us for our next webinar. Again, that will be part of our COVID-19 webinar series, where we will discuss vaccine hesitancy in high-risk communities. We have some very interesting data from Dr. Monica Webb Hooper with the Office of Minority Health, where she'll be joining us and will help us to take a look at the insights from those high-risk communities and the vaccine hesitancy data. Also, we'll have Dr. Purvi Parikh and myself in this webinar, so please mark your calendars, March 17th at 4 p.m. Eastern. Again, I want to thank you for joining us. Definitely want to thank the CDC, National Asthma Control Program, and the staff that supports us there. On behalf of the staff at Allergy and Asthma Network, again, thank you for your time, and we hope that you will join us as we create partnerships in allergy and asthma care to improve health outcomes so we can all continue to breathe better together. Thank you and have a great day.